Fentanyl, an opioid so powerful that it's become one of the most dangerous drugs in the world today. It's a medication that is prescribed in certain medical settings, but when misused, it has led to thousands of deaths and is a key player in the ongoing opioid crisis. In this video, we will explore what fentanyl is, how it's used, why it's so deadly, and the profound impact it's having on individuals, families, and communities. Stay with us as we delve deep into the science, the addiction, and the tragic consequences of fentanyl. Fentanyl is a synthetic opioid that is 50 to 100 times more potent than morphine and approximately 50 times stronger than heroin. Originally developed in the 1960s, fentanyl was created as a pain management solution for patients undergoing surgery or those suffering from severe pain, particularly in cancer treatment. In a medical setting, fentanyl is used in the form of patches, lozenges, and injectable solutions. When prescribed and used correctly under medical supervision, fentanyl can be an effective painkiller. However, its potency also makes it incredibly dangerous, especially when it is abused or mixed with other substances. Fentanyl abuse, however, has grown at an alarming rate. The opioid epidemic in the United States, which began with prescription opioids like OxyContin and Vicodin, took a tragic turn with the rise of fentanyl. As prescription opioids became harder to obtain due to tighter regulations, illegal fentanyl emerged as a cheaper, more potent alternative. Illegal fentanyl is often sold on the black market in the form of powder or pressed into counterfeit pills, disguised as common prescription drugs like Percocet or Xanax. These counterfeit pills are often laced with fentanyl without the buyer's knowledge, leading to accidental overdoses. What makes fentanyl so deadly is its sheer potency. Just a tiny amount of fentanyl, about the size of a grain of salt, can be fatal. When someone consumes fentanyl unknowingly or in too high a dose, their body can quickly become overwhelmed, leading to respiratory depression, which is when the breathing slows or stops completely. Respiratory depression is the leading cause of death from a fentanyl overdose. The drug suppresses the central nervous system, slowing down the body's ability to function. In many cases, an overdose occurs so rapidly that immediate medical intervention is needed to save the person's life. Fentanyl's impact on the opioid crisis cannot be overstated. Since its illegal distribution became widespread, fentanyl has been a driving factor behind the surge in overdose deaths across North America. According to the Centers for Disease Control and Prevention, fentanyl-related deaths accounted for more than 60% of all opioid overdose deaths in the United States in 2020. While prescription opioids have contributed to the crisis, fentanyl has taken it to a devastating new level. Its low cost, high potency, and easy access on the black market have made it the drug of choice for both dealers and users. For many addicts, fentanyl is not just a replacement for heroin or prescription pills, it's an even stronger, more dangerous drug to get high. The human cost of the fentanyl epidemic is staggering. Families are left grieving lost loved ones, communities are overwhelmed by addiction, and emergency responders are stretched thin. Law enforcement agencies, healthcare workers, and local governments are working tirelessly to combat the spread of fentanyl. But the battle is far from over. Fentanyl-related deaths have not only caused heartbreak for families, but also put a strain on healthcare systems, first responders, and law enforcement. Medical professionals, for example, are often exposed to fentanyl while attempting to revive overdose victims, putting themselves at risk. Naloxone, a medication used to reverse opioid overdoses, has become an essential tool in the fight against fentanyl-related deaths. Efforts to combat the fentanyl crisis are ongoing, with multiple approaches aimed at both prevention and treatment. Public health campaigns have been launched to raise awareness about the dangers of fentanyl, particularly the risk of counterfeit pills. Additionally, Harm reduction strategies such as needle exchanges and access to naloxone are proving effective in saving lives. At the same time, addiction treatment programs are adapting to the unique challenges posed by fentanyl. Detoxification, rehabilitation, and medication-assisted treatment are among the most common approaches to helping individuals recover from fentanyl addiction. Despite the ongoing efforts to tackle the fentanyl crisis, the problem continues to evolve. Fentanyl's increasing presence in illegal drug markets around the world shows that the fight is far from over. Authorities are also seeing new, even more potent variations of fentanyl, such as carfentanil, an opioid used as an animal tranquilizer. The battle against fentanyl is a complex one, requiring coordination between governments, healthcare providers, law enforcement, and communities. Only through a combination of prevention, treatment, and education can we hope to reduce the devastating toll that fentanyl continues to take. The fentanyl epidemic is a stark reminder of the dangers of opioid abuse and the devastating impact it has on individuals, families, and society as a whole. It's a crisis that is still unfolding and one that demands our attention and action. Thank you for watching. If you found this video insightful, please like, comment, and subscribe for more content about the opioid crisis, addiction, and public health. Let us know your thoughts on fentanyl and its impact, and don't forget to share this video to help spread awareness. Stay safe, stay informed, and let's continue the conversation on how we can tackle this epidemic together.